Contrary to many people's understanding, we have put in place many systems to help us respond to the first case. We're lucky in South Africa. We have had a bit of time, where we have had a 6-week head start on Wuhan. Should a specimen test positive, we have a number of epidemiological things that will happen. The index case, as we call the first person, will be asked to provide a list of contacts, persons they've been in contact with, and that will include close family members, work colleagues, health care workers who were at the hospital or the facility where the patient was diagnosed. And if the person was travelling in the last 2 days, that's the infectious period, or at least the window that we will do contact tracing in, we'll get flight manifests from the airlines. And then we will identify the contacts working with the provincial health departments, and we will ask the contacts to self-quarantine. That means for 14 days we will ask them not to have any contact with members of the public, not to use public transport, not to go to work or school, and to keep a social distance from family members in the house, to cover their face with a mask, so that should they start developing symptoms, they won't transmit the disease onwards. So certainly for the first, until our capacity is exceeded, we will follow that same procedure for every single case of coronavirus that is diagnosed. You'll appreciate that's a collective effort. That's not something anybody can do on their own. And crucially, it involves the cooperation of the public. So an individual will need to adhere and take on board the request to self-isolate, and will need to follow through. Should one of those contacts develop symptoms, we will be monitoring them with the help of the provincial contact tracing teams, and we will immediately test that person and isolate them should they require that. We may not necessarily admit every single person who has coronavirus infection. As I shared with you, the vast majority of people, 80%, have asymptomatic, have mildly symptomatic disease and will not require admission. And admitting a person like this to a hospital is perhaps one of the most dangerous things you can do, because then you put healthcare workers at risk. So we really don't want to do that if it's not necessary. There, of course, will be social ramifications if the disease is not containable. And then the broader health structures in the community and the country will kick in to make decisions around cancelling public events or limiting exposure in one way or another. But that is beyond the remit of the NICD.